this is a situation that the NHS has not faced before. I cannot stress that enough. We are cancelling all manner of planned care. We are cancelling planned operations. In some hospitals, cancer care is having to be cancelled. We've got strain on the entire service from the front end to the back end. We've got strain on ambulance services right through every department in the hospital and through the back end into social care. The staff on every floor of the hospital are exhausted. They are working all the hours that God can send, and yet still the patients are still coming. There is a large amount of work still to do, and the front line is coordinating fantastically. So there is work going on between hospitals where one hospital cannot provide a service. Other hospitals are taking those patients, and the ambulance crews and the pre-hospital teams are doing fantastic work in terms of coordinating that. But make no mistake, the entire service all around the country is under strain from winter pressures, on top of which we are facing COVID.
My understanding is also that younger people are coming into the system with very, very serious infection and very, very serious symptoms. It's not just as it was earlier in the epidemic, older people who are getting it, and sadly older people who are dying.
So throughout this pandemic, people of all ages have been affected. We are seeing more younger patients being admitted, but that may be a reflection of the fact that we're seeing far more cases than we saw in March and April.
Some of this due to the mixing over Christmas?
I don't think it helped. And there is a degree to which that may well have contributed. We are where we are now. And certainly this is something that needs to be looked at. So at the Doctors Association, we asked for an inquiry back in April and May so that we could learn the lessons of the first wave. Unfortunately, that has not happened. And I'm sorry to say that some of those same mistakes are being made again. So we have doctors, nurses on the front line who are concerned about PPE guidance, who are not being listened to. This is the same situation that happened in late March.
And Sadiq Khan declaring a major incident, what does that mean in practice?
So I'm going to quote Professor Kareem Brohi, who's a trauma surgeon in East London, who put this much better than I did. So what the major incident means is that it allows a coordination of multiple teams to provide, so that we can provide the best care that we can. It doesn't necessarily mean that we can provide the best care that everybody is used to. This is what we are trying to do with a major incident, is protect the staff and resources to try and cover as many people as possible.
And tell me, do we need to go further? Because yes, we're locked down, but we're not locked down as stringently as we were locked down in March. Some countries, for example, have a curfew. I mean, will we need to go further to contain this? Because there'll be a lot of people listening who say, listen, I'm worried that if I get it and I end up in hospital, I'm ending up in a hospital that's rather pressured, and I'm doomed. They're nervous about getting it precisely because they know the hospitals are under pressure.
And that is a reasonable fear to have. What I would say is a few things. So the first thing is, if you are sick, and you are unwell and you are in need of hospital assistance, you need to attend. We will treat you. I cannot stress that enough. In terms of greater lockdown measures, what I would say is that there have been problems with how lockdown has been communicated. There have been problems in how lockdown has been supported. So there are a large number of communities, you will know this yourself in your own constituency, where people will find it difficult to engage with lockdown because quite simply, they cannot afford it. If it is a choice between the virus and food, that is a very difficult choice for families to make. Yeah. And so there needs to be an increase in the support for lockdown in terms of financial and social support that will improve the engagement with it. This is a fight for every single person in every single situation. As a country, we need to realise that, and we need to modify our actions to enable that to happen, and that will improve our response.
Now, just I want to put a point of view, because there are those who think that this is overkill. 80,000 people have died, but they say, hang on a minute, in a population of over 70 million people, why are we going to this extreme over, yes, very sadly a virus, but something that should not have the economy locked down and have our lives affected to this extent? And it is important that I put that point of view, because it's a point of view that you will have heard.
Indeed. So I would say, again, a few things. So the first thing is we have 80,000 people who have sadly and tragically passed away, having engaged with all of these measures. If these measures had not been engaged with, that tally might have been a lot worse. Now, there are actors and communicators who will quote certain people who will disagree with that viewpoint. What I will say is the following. Our hospitals are full. Our hospitals are strained. That is not being made up. That is in spite of a lockdown. That is despite all the tragedy and the hardship the country has endured. This is a crisis point, and it needs to be treated as such. To deny the crisis will exacerbate it.
Do you fear cases and deaths continuing to rise? We're not near the peak of this.
So, unfortunately, we are still a few weeks from seeing the impact of increased lockdown measures that were introduced in late December. So we are on the tail end of what we're seeing there. So I'm afraid this is going to get harder. Projections for London, for the Midlands, are, I can't even say sobering reading. They are horrific in terms of what they're projecting. And this, unfortunately, we are still on an uptick in terms of cases. We're losing over a large hospital worth of people per day. If these were terrorist attacks, there would be outrage. These are individual tragedies. Each one has got somebody mourning for them. Often this is the generation that fought or grew up in the war. This is a national tragedy that is unfolding in front of us. The point, at the best point, is that every single person can help in fighting this. And that involves, as much as possible, engaging in the lockdown measures, keeping your distance, washing your hands, wearing a face mask. I appreciate that these are all impositions, and this is not the life that we led in 2019. Unfortunately, this is not the world that we live in 2021, and we have to adapt, or there is more tragedy to come.